Bismillah ar-Rahman ar-Rahim. We will continue our second lecture regarding the anatomy of the heart for the second grade Medical College AL-IRAQIA University. We talked previously about the heart with its chambers, and we should mention this lecture is for some of the emerging blood vessels, great vessels that emerge from the heart. One of them, as we know, is the superior vena cava. The superior vena cava, anatomically speaking, is formed by two veins, which are the left brachiocephalic vein and the right brachiocephalic vein, which these two, the brachiocephalic vein is already formed by a major vein present in the neck region called the internal jugular vein with the subclavian vein, which is the continuation of the axillary vein from the upper limb. Both of them will be united behind the sternoclavicular joint on each side. The left, as you see, is obliquely set and longer than the right brachiocephalic vein. Then both of them will unite just behind the first costal cartilage. Right first costal cartilage, behind it there will be the union of the two brachiocephalic veins forming the superior vena cava. The superior vena cava is 7 centimeter in length, 3 inches تقريبا, and its diameter is 1.3 centimeter, which is about half an inch تقريبا, and it is one of the great veins that has no valves in our body. Regarding the costal levels, أكو some of the numbers حتى لا تنساها. I have number 1 and 2 and 3 costal cartilage. The superior vena cava is related to the right first costal cartilage, right second costal cartilage, and right third costal cartilage. How come? شلون نشرحها هذا? The right first costal cartilage is the union of the two brachiocephalic veins to form the superior vena cava. This is level number 1. The level number 2 is that it passes through the pericardium. The pericardium is a serous membrane that surrounds the heart and the beginning of the great vessels also. So when the superior vena cava passes through the pericardium, it is behind the level of the right second costal cartilage. At the right third costal cartilage, it enters into the heart. So these three, we can say, anatomical landmarks are always related to the superior vena cava when we study it, first and second and third. When we talk about a vein, when we talk about an artery, we say the artery has its branches. In the vein, we say the vein has tributaries. ما نقول branches of the vein, نقول tributaries of the vein لأنه تصب بيها. بينما branches of the artery لأنه originates from the artery to the rest of the body. Tributaries of the vein اللي هي فينات جاية تصب بالvein الأصلي. So the superior vena cava has a very important tributary, which is the azygous vein. The azygous vein, طبعا احنا we have in the thoracic region, we have azygous system, azygous and hemiazygous system, which will be given as a lecture by its own. It's a plexus of veins in the thoracic cavity. In order to show you a best view about the azygous vein، هنا ما عندي صورة، المفروض أبين لك صورة شلون يصب بيها. لكن the azygous vein is a tributary that arches above the right lung root, and it will enter in the superior vena cava at the level of the second costal cartilage, at the level of the sternal angle. تذكرون كل الزيام من قلنا احنا الاسترنال انجل شلون اكو هوايه structures بالثوركس راح من نذكرها نقول at the level of the sternal angle there is a flan organ, there is entrance of flan vein, there is the beginning of a flan structure. هسه راح نبدي نذكرها. يعني the azygous vein, if you are asked, it is tributary to the superior vena cava, and it is the end result of the azygous system in the thoracic cavity, and it will drain in the superior vena cava at the level of the sternal angle, at the level of the second costal cartilage, or T4, and it arches above the right lung root. Okay, this is regarding the superior vena cava. If we talk about the inferior, طبعاً superior vena cava will open into the right atrium as one of the great openings inside the right atrium. Opposite to it, inferiorly, I have the inferior vena cava. If I want to talk about the inferior vena cava, it starts originally in the abdomen by the junction of the two common iliac veins at the level of L5, the fifth lumbar vertebrae. هناك يتكون inferior vena cava slightly to the right to the vertebral column and ascending upward. يعني يصعد بالأبدومن إلى أن يوصل to the diaphragm. In the diaphragm, it will enter through the caval opening, it is called, at the level of T8. At the eighth thoracic vertebrae, it will enter through the diaphragm. When it enters the diaphragm, it will enter inside the thoracic cavity. It is one of the structures present in the posterior mediastinum, and it will ascend upward until reaching to the opening in the right atrium. The inferior vena cava, near its entrance to the right atrium, has a rudimentary valve. This is the inferior vena cava. If I want to talk about the pulmonary trunk, it arises from the right ventricle, and it carries the deoxygenated blood, and at the level of also the second costal cartilage, yani the sternal angle, it will bifurcate into the two right and left pulmonary arteries. They are called pulmonary arteries, but they carry deoxygenated blood to the lung. It will reach to the right and left lung roots, then to the lung itself. This is regarding the pulmonary trunk. If we talk about now the aorta is divided into ascending aorta number 1, arch, this is the ascending aorta number 1. Then I have the arch of aorta number 2. Then I have the descending thoracic aorta number 3. These are the 3 parts of the aorta. If I talk about the ascending aorta, ascending aorta starts from the left ventricle as 3 semilunar valves called with spaces called the aortic sinuses, and what arises from the ascending aorta is the right and the left coronary arteries, which we discussed in the previous lecture as the major blood supply to the heart. The ascending aorta is a part of aorta which is covered by pericardium. Okay, يعني نخلي هذه الفكرة ببالنا. And it ends, نقدر نقول نهاية ascending aorta is at the level of the manubrium, at the level of the sternal angle, and the beginning of the arch of aorta is at the level of the sternal angle, and the end of the arch of aorta is at the level of the sternal angle also. يعني the arch of aorta starts and ends at the same level, but it starts anteriorly and ends posteriorly, as you see, and it is an arch. طبعا the ascending aorta arises and upward, forward to the right, while the arch of aorta will arch from the right to the left. Each is from anterior to posterior. From the arch of aorta, I have 3 branches. These 3 branches are called brachiocephalic trunk, which will divide into right common carotid and right subclavian, and I have the left common carotid and the left subclavian arteries. These emerge from the superior surface of the arch of aorta. Inferior to the arch of aorta, I have a ligamentum arteriosum, which we previously discussed it in our anatomical lab, and we said that it is a remnant of ductus arteriosus, which was a patent connection between the pulmonary trunk, mainly between the left pulmonary artery and between the arch of aorta during life, at birth, or even sometimes it extends up to 1 week of birth. There should be closure of this ductus arteriosus to form ligamentum arteriosum. Okay, now this is arch of aorta. When it ends طبعا near the lower surface of the fourth thoracic vertebrae, and it will continue as the descending thoracic aorta. The descending thoracic aorta is one of the structures of the posterior mediastinum, and its branches are طبعا 9 pair of posterior intercostal arteries from 3 to 11. يعني احنا كنا نعرف عندنا 12 intercostal space، من 3 إلى 11 pairs posterior intercostal arteries are branches from the descending thoracic aorta. ال 12 يسمى اسم خاص اسمه subcostal artery, which is also يعني subcostal artery يتسمى ال 12. بينما الواحد والاثنين I wanted a homework from you. يعني the first and the second pair of posterior intercostal artery, from where does it emerge? ومثل ما قلت كلمة posterior intercostal artery, there is an anterior intercostal artery which emerges from the internal thoracic artery, and يعني it's branches from it. As also said before by the lecture done by Dr. Ahmed قبل انطاكم محاضرة عن intercostal spaces with its branches. بس هسه احنا إذا نريد نحاول نربط، يعني أريدك هسه تربط إنه the descending thoracic aorta gives 9 pairs. The 12th is called the subcostal, and the first and second are the first and second posterior intercostal artery arises from. I leave it a homework for you in the anatomical lab. We will discuss it. This is طبعا the 4 pulmonary veins. هنا عندي the 4 pulmonary veins are called pulmonary veins, but as we said, they are the only veins in the body that carry oxygenated blood from the right and left lungs to the left atrium. They open into the left atrium. This is a quick review about the great emerging blood vessels from the heart. You can get benefit from this also PowerPoint. يعني try to read, after you read the whole heart, try to see the pictures in this presentation. Hopefully you will have a complete picture now about the heart anatomy. The next lecture will be about the lung. Wishing you the best. Thank you very much.